First cases of coronavirus in India were reported in January 2020. Nearly 2 years on, the children of butterflies are facing the persistent health challenges of this global pandemic. Mental health is often among the most neglected aspects of a crisis like this, and the Butterflies team reports an ever-increasing need for psychological support for children. Butterfly's 24/7 emergency childline service continues to be flooded with requests from government agencies and individuals to reach children who are alone because their parents are fighting COVID in the hospital or have lost their battle. These children are scared, hungry, and emotionally distraught. Their distress is exacerbated by growing anxiety and uncertainty about when or if the pandemic will end. Before COVID-19, India had the highest suicide rate in South Asia. Now, India's mental health system is being pushed to the limit, with a catastrophe of increased demand, woeful supply, and fatigued frontline workers. Butterfly's trained staff conduct intake interviews of the children identified through Childline services, learning as much as they can about their background and family situation, and assessing their physical and emotional needs. In addition to providing food, masks, and hygiene kits to these children in crisis, Butterflies prioritizes their mental health by offering psychosocial services from experienced professionals like Priyanka Lakra.
My work comprises of casework sessions and therapeutic intervention with the children. And along with it, I am involved in taking group work sessions and also life skill sessions on different topics like decision making, healthy relationship, problem solving, anger management, as well as awareness sessions on child protection issues like safe, unsafe touch, violence, child rights.
Clinical caseworkers like Priyanka meet children where they are, working day by day to gain their trust and helping them to process their emotions as they deal with stress, anxiety, depression, and trauma. For these children, learning to understand and deal with emotions in healthy, productive ways takes time and resources.
There are times when you want to talk to the children, but they will not respond or even acknowledge you sometimes. They'll be too stubborn to listen or have a conversation with you. With those children, I focus first more on giving them space and building relationships. When we work with the children, it is important for us to move with the pace of the child. And I focus on doing things which they like to do. It can be drawing and coloring or playing. You have to engage them. And during those moments, we can have conversation and they'll be open to you.
In addition, to help prevent situations that warrant emergency child protection mechanisms, Butterfly's staff hold awareness sessions for parents and for local small businesses like rickshaw drivers and kiosk owners in the marketplace near Childline help desks and other locations. Butterfly's child protection officers like Priyanka are also involved.
I am also engaged at community level, conducting and sensitizing different communities with Childline team. And the aim of this community awareness campaign, is to empower the marginalized and vulnerable communities with the knowledge on different laws and rights related to children.
Butterflies also understands how important it is for professional staff to pay attention to their own mental health so that they can continue to meet the needs of the children and find joy in their work. Taking time for self-care and seeking support from their support networks is essential.
It is important as a practitioner to give importance to your own mental health. When I feel low, I usually make an effort to talk to my dear and near ones. Luckily, I have strong emotional support from my parents and my friends. I do talk to them about my challenges and frustrations. And for me, talking about it to someone who listens works, and it helps me tremendously.
Join Butterfly's 2021 campaign to invest in children's lives by supporting their mental health and personal resilience. Your help will enable them to survive and thrive through the COVID-19 era, well prepared to face new challenges ahead. Help us raise at least $20,000 for Childline's life-saving activities and to improve and expand the breadth of Butterfly's child psychosocial services, including support for the caregivers. all part of the continuum of positive mental health across communities. Please be as generous as you can and know that every amount helps. 100% of your donation will go to providing services to children in crisis. So click on the donate button now, and thank you.